Hi. Go ahead and introduce yourself and then share with us a little bit about some of the symptoms that you were dealing with before you became a patient at Perkins Family Wellness.
Okay, I'm Brenda Pettit. I am 47. Some issues I had, this summer, I experienced vertigo, which was terrible. Mm-hmm. And it did pass, but it was terrible. I don't know, it was just awful. And other things I have, the right side, going from my lower back to my hip, my knee, and then my heel. I was experiencing a lot of pain all at different times, or not all at once, different parts at different times. Mm-hmm. But there was a lot of pain there. So came in to see if Dr. Perkins could help. Mm-hmm. And I was adjusted. And I'll tell you, the very first day, I walked out of here, and my right side pain had gone. But the thing that I didn't even notice, that I didn't actually come here for, that I was noticed the most, was I had been feeling, and I don't know if it was vertigo, I had this weight on me. And it was almost, I don't even want to say depression, but everything was just very serious. It was a weight, basically. Mm-hmm. And just every day, just walking around, just thought that's the way life was. I thought hormones were changing, everything's serious, everything's just, I don't even know how to explain it. And I didn't realize so much, I just thought that's the way life is going to be from now on. Mm-hmm. But that day when I walked out and I'm in the car, it was like this weight had been lifted. And my whole life was lighter again. I could feel my body again. I was experienced like, I think I tell people my body was turning to stone. Like mm-hmm. I would just feel awkward and achy, but walked out of here, I'm in the car, and it was just everything. I feel like this because like something was lifted, and I just felt better.
That's
and
awesome.
That was that day. And that night, I just slept. And that was one thing I didn't mention, that I think I get used to it, and that's just the way life is going to be. Mm-hmm. And I would sleep, but I wouldn't get good sleep. Yeah. So I could sleep the 8 hours and wake up and just feel, like a truck got hit by a truck. Mm-hmm. That night. Even though it wasn't 8 hours, I slept wonderfully.
That's awesome.
And I just felt great.
So you got your first adjustment only 3 days ago. Yes. Right?
Yes.
And tell us a little about some of the things that you've experienced just in that short period of time.
I feel, my pain is gone.
That's awesome.
It's not eliminated. It's still there. Not there. It is, I can move again.
That's cool.
So it is, I'm back to being
mm-hmm.
normal, being a person again. So I can move and do my laundry without, do the back to normal things.
So what would you share, or what would you tell someone who's contemplating upper cervical care for themselves?
Oh, it is wonderful. It's a gentle adjustment. So I think maybe people think when you're thinking your neck, they get mm-hmm. freaked out, but it is, you don't even notice it. It's just a gentle adjustment. Mm-hmm. And like I said, I didn't even realize, I came in for the pain on my right side, mm-hmm. but this other things are better, or I'm back, my body's back, and my daughter came too. She's 15 and she's had ringing in her ears, mm-hmm. and we've come to see if that is helping, and that is helping. Mm-hmm. But the side effect too, another plus is she has bunions, mm-hmm. and that is actually helping the pain in her feet.
That's awesome.
Which we came for this, and her body is adjusting and feeling better.
That's terrific.
So you may think you're coming for one thing, but there's other things. It's like your body's coming back, mm-hmm. coming back to being. Just being.
Yeah. Well, thank you for sharing. I really appreciate it.
So yes, do come.